Hello, dear students. We'll discuss a topic or a clinical case which is very commonly seen in surgical side. In the exam, they will keep short case, and oxy they will keep. Some short notes will come. MCQs will be asked. So, what this condition is? Look at that. It is healing ulcer. Healing ulcer with healthy granulation tissue. Look at that granulation tissue. You know that there is a fibroblast proliferation and new vascularization, new capillaries will be there, and that promotes the healing actually. That's once ulcer bed it forms, so you can put a graft and healing initiation it occurs. That's why this healthy granulation tissue is important. Unhealthy granulation tissue, sprouting granulation tissue, proud flesh it is called. Different types of granulation tissues are there, and sometimes this granulation tissue will be localized so much like it forms a neoplasm like that is called pyogenic granuloma, granuloma pyogenicum. It's a short note for you. Short case may be kept also. Oxy they will ask. The different forms of the granulation tissues are like that. So sloping edge, well-defined margin. You know that margin should be told as well-defined, ill-defined. That's only on inspection. Margin cannot be palpated. Whereas edge is inspection, palpation. Edge is infected, sloping, undermined in tuberculosis, raised and everted in carcinomatous ulcer or epitheliomas. And rodent ulcer, beaded appearance, and punched out ulcer is in the trophic ulcer, like in trophic ulcer in the foot, or gummatous ulcer in syphilis. Because of the end arteritis, it becomes very punched out. Deep bone is the base in the trophic ulcer, whereas undermined is a typical of the tuberculous ulcer. Like the different ulcer edge, different edges you should know. This is the sloping, this is the punched out, and this is the tuberculous undermined ulcer, and raised and everted ulcer, the carcinomatous ulcer, and beaded, very typical of the rodent ulcer, like this. It's very typical. The different types of ulcer, different edges, very commonly asked MCQ question. Carcinomatous ulcer, which edge? Rodent ulcer, beaded, and undermined tuberculosis, like that. You should remember very clearly. And YU also they will ask, short case also they will ask, oxy also they will ask. So you should know that. And how to manage this patient? A discharge for culture sensitivity, accordingly antibiotic protocols. Sometimes the tissue sample should take for the quantitative analysis of the bacteria per gram of tissue. It should be less than 10 to the 5 of streptococcus to place the graft. That point you have to remember. Wound cleaning, wound dressing with the Usol, and different solutions. And you have to check hemoglobin and blood sugar. If it is high, it should be controlled with insulin actually. And serum albumin should be more than 3 g/% to allow the graft to take up. And after that, staged graft is, you should remember the stages of the graft intake. Stage of graft, plasmatic imbibition. Plasma imbibes, comes in between the donor graft and recipient bed uniformly. That is plasmatic imbibition. And the stage of new vascularization, new vessels like this comes back like this. Then perfusion occurs, stage of circulation. The 3 stages of the split skin graft intake, partial thickness graft intake, or chest graft intake. Humby's knife is used. So the commonest donor area is the thigh. Then other areas also you can use. In a large area, you can use mesher so that it forms a mesh like that, increases the size of the donor graft. So the wider area you can cover. And currently electrical dermatomes are available. Humby knife and Eschmann blade, Downs blades are commonly used in a day-to-day surgical plate. If electrical dermatome is there, it will be luxuriant, easier to take. Uniformly you can take. So remember, classification of ulcer, I already told. Spreading, non-healing, healing, callus ulcer. That is the clinical classification. Etiologically, specific, non-specific, arterial, ischemic, arterial, venous. Venous ulcer is very common in the around the ankle. Then diabetic ulcer, hypertensive ulcer, then so many basin disease, then specific causes of tuberculosis, syphilis, neoplastic causes of carcinomatous rodent ulcer, like that. Other classification, factors affecting local and general factor, local infection, foreign body, around the joint, immobilization, mobilization, mobility, joint involvement, all the things, local factors. Systemic factors are anemia, albumin, deficiencies, malnutrition, and vitamin deficiency. All those things are the diabetes, malignancy, radiotherapy, patient on steroid. All those things are the general factors. Local factor, general factor. Clinical classification I have told. Evaluation I already told. X-ray may be taken. X-ray, MRI, ultrasound, Doppler, venous and arterial Doppler, and local treatment is skin grafting. Three-edged graft is a common graft. Is split skin grafting. Another is full thickness graft, not used in a wider area, a small area around the joint. Full thickness is used, so remember. That's called the wolf graft. But this is three-edged graft. Wolf graft is only local is small areas around the joint where you should not have a contracture. Where a three-edged graft causes a contracture, primary and secondary contracture. So treatment I already told. Technique of skin grafting. Humby's knife from thigh to tail, you have to place it. Where donor area you have to remove only after 10 days. Whereas recipient bed should be inspected in the 4th or 5th day after grafting. So in detail technique you should know. Different knives will be asked as MCQ, Viva they will ask. So skin grafting is very, very important in a healing ulcer. So answer the MCQ. Undermined edge is seen in healing ulcer, tuberculous ulcer, rodent ulcer, trophic ulcer. Students, please put the answer in the comment box. I will get back to you. So students, I hope you understood this simple but important topic, healing ulcer, very well. Thank you so much. So students, go through my SRB's clinical methods in surgery, which has got a video lectures of each topic. So many topics are covered. Every topic as far as CBM syllabus is covered. How to examine the patient. Swelling, ulcer, arterial disease, venous disease, thyroid, breast lump, mass abdomen, briefly orthopedic, every system, whatever your required thing, everything is covered. There is a video of how to examine of each topic, and principles of examination is good, and differential diagnosis in the table format is given, and briefly investigation. Suppose treatment is not a topic will be covered in a clinical method examination, remember, and many photos of most of the conditions with the illustration. Photos will tell the clear idea about for the students how exactly condition looks like. So covers everything with the beautiful photos, and it also gives the instruments, specimens, then operative surgery briefly. Everything is covered. Small images also it is covered. So it is more than sufficient for all undergraduate, postgraduates of any system to learn. Very basic required thing for the surgical field is clinical methods. So please go through that and purchase that and make use of it. My SRB manual of surgery is very popular. It covers theoretical aspect, everything, principles, treatment in detail, briefly technical aspect, and with the photos, illustrations, quotations, all topics with the specialty, urology, cardiothoracic, neurosurgery, and operative surgery instruments. Again, it is covered in this book also. Every quotations, and you should worldwide also, actually including our country, everywhere. And please, you can make use of it. My operative surgery book, SRB's operative surgery atlas, that is a 2-volume book, covers in detail operative technique of surgery, all surgery, small surgery, major surgery, everything with total around more than 10,000 illustrations and photos. It gives very good principles and technical, step-by technical aspect. Very, very useful for postgraduates. Not much useful for undergraduate, but it's a postgraduate book and consultant book and learner after MS. It gives everything. You can, before going to surgery, you can always read this book and memorize your steps and do the surgery properly. Every topic, general surgery, gastroenterology is covered in detail, step by step with illustrations. And my SRB's atlas of tissue approach, small book atlas, 100 pages, how to do the suturing, tissue approximation, including laparoscope suturing with the video. It is covered. So any basic learners, suturing is very, very important surgical field as a skill actually. Dissection and suturing, so the two parts of the surgical skill. So that is also covered very well with videos. You can always go through that. And my website, please subscribe, all of you. Your daily lectures are there, live sessions are there. My digital lectures through JP Publishers, around 220 hour lectures. Entire thing as for CBM is covered with the examination part, with all topics of CBME, ulcer to operative surgery, instruments, specimens, examination, specialties, basic, everything is covered. You can always purchase for 1 year and have a clear idea about the surgical topics, understand very well and helpful for your exam, NEET, MCQs. Also, it is there both in manual and my lectures. So students, I hope you have understood this lecture very well. Thank you very much.